Doctors and nurses of Reddit, what have been your why didn't you come in sooner moments? Imaging guy here. I have a million of these. I work with vascular patients and wounds. Had a guy whose foot was completely broken sideways at the ankle. He had it still wrapped from when he left the hospital. He would use the stumpy part to move around on his wheelchair and leave little blood sponge prints on the floor. Another guy with bad ankle and foot wounds decided to stop going to wound care, and was afraid to take the wraps off even after his foot started to stink. By the time I saw him, his skin had kinda liquefied. Earlier on in my career, I saw a guy with necrotizing wounds to both legs that had eaten to muscle in multiple places below the knee. I asked him how long they looked like that, and he said about 2 years. Next time I saw him, he was bilateral above knee amp. Stump wounds. Just stump wounds. Take care of your feet, people. If you're diabetic and can't feel the bumps and scrapes, please check your feet regularly. Former medic here. Called to a patient who had cut their leg while chopping wood about a week prior, and now it was really itchy. Old gentleman. Didn't drive. Lived alone. Got to his house. Unwrapped the ungodly swollen leg to find that he'd tried to superglue the wound closed and maggots had commenced to growing inside. The itching he was feeling was the writhing maggots under his skin. On the plus side, the maggots likely kept him from developing sepsis. True. I was just expecting dry skin or something. Not, you know, attack rice. Rice is now dead to me. Guy came in with a dead leg. Waited until it turned black and then decided to head to the ER. They tried an angiogram to open up blood flow, but it was way late for that. Guy had several clots in his lungs and legs. Undiagnosed atrial fibrillation. He couldn't believe we were going to amputate. Kept asking me what else I could do. Go back in time a week ago and come in. Kinda around when it turned blue. It's amazing a person can have a dying leg. Blood clots, which I get he might have never noticed that one, plus a heart condition, and still not feel the need to go to an ER at the very least. This happens all the time. People have a big stroke at home and can't move an entire side of the body. They wait several days thinking it's a flu or something. Nope. Not the flu. Just a large clot in the brain that could have been reversed if you came in right away. In the case of a stroke, they might also not be able to even recognize the severity of the symptoms, or even be able to appreciate that the paralyzed body parts are their own. I was an EMS supervisor for a while, and once ran on a patient with classic stroke symptoms, sudden onset one side paralysis. She was still able to talk, though, and insisted that she neither needed nor wanted to go to the hospital. That was why I, as the supervisor, had been called. The paramedics on the scene, good paramedics, knew they were treading that thin line between necessary transport and the patient's stated desire to not be transported. So I talked with the patient for a little bit and ran into the same problem. So I touched the patient's good leg and asked her if she could feel that. She said yes. Then I touched her bad leg and asked if she could feel that. She said no. I asked her if she could tell me why she couldn't feel it, and she replied that it wasn't her leg. I knew she needed to be transported, and that reply was all I needed. I told the medics that they could transport her, because obviously her mental acuity was impaired to the point that she was unable to make informed judgments on her own care. I made sure they knew that that was the way to write the report, too. And once we started to load her up, she provided no resistance at all, which is pretty much what I expected. Never got any word back on how she did, but also never had that decision come back and bite me in the ass. People who have had a stroke are obviously not thinking right. When my granddad had one, His biggest concern was not wanting to go to the hospital before he put his socks on. He slowly put on one sock, got the other sock, and put it on the same foot. He realized that was wrong and took the socks off. Then he started again, with the same result. He repeated this multiple times until we had to beg the ambulance dudes who were standing there watching to just take him regardless of if he said he was ready or not. At the time I thought he was doing the sock thing because he was just so confused. But now I wonder if he was doing it because he knew he had two socks to put on, but didn't recognize the other foot as his. My mom had a stroke browsing in a store with my dad and me. I just happened to go looking for her and found her sitting on the floor next to my dad. She was a very dignified woman and would never sit on the floor in public. So I knew something was very wrong. Immediately started thinking stroke when I heard her start trying to speak. But the two things that were most astounding in the moment were: 1. How hard she insisted there was nothing wrong with her. And 2. That she just didn't recognize her left side as part of her body anymore. She was also extremely concerned about where her purse was. I can't thank the EMTs, doctors, nurses, physical therapists, medical aides, etc., who helped her in the aftermath enough. She lived, but never really regained mobility, and completely lost all math skills, before dying 5 years later. Learn the signs of a stroke. Don't let your loved ones convince you there's nothing wrong. Doctor here. Might be a bit late and will probably be buried, but had a 65-year-old dude who was diagnosed with lymphoma 8 months before we saw him. He lived an hour out of the city and didn't want to drive in for treatment, so decided he wouldn't get treated at all and stayed on his little remote place in the country by himself. Essentially, because it didn't get treated, it spread along his skin and his neighbors called an ambulance when popping in on him. It had spread so far that it essentially went from his head to his knees. It had started to invade his eyes and mouth membranes. He couldn't drink and could barely see. His skin had started to slough off and he was so severely dehydrated because he was losing so much excess fluid from his open skin that we had to treat him like a severe burns patient and had plastics involvement. The consultant said if he had received treatment, there was a chance he could have recovered. Instead, he died 3 weeks later. Years ago, as a nursing assistant on an oncology floor, we had a guy admitted because he had had an erection for several days and had lost the ability to pee. His bladder was close to bursting and his poor junk was, think microwaved hot dog, really bad. But none of that was as interesting as the fact that this guy had untreated skin cancer on his nose for several years that had over time become infected, developed MRSA, and spread across his face. He had no nose, no cheek, and no eye on one side of his face, and was starting to lose his other eye. You could see part of his peeping skull. I don't know why he chose to leave it untreated, and I have no idea how long it took to get that bad. But I will never ever forget the smell and texture of his rotting face. On the upside, we were eventually able to convince him to have reconstructive surgery. He ended up getting a skin graft that covered up his eye, nose and cheek. So, if you ever meet a very grumpy dude with nothing but a mouth and one eye, know that this is way better than the alternative. Holy speep. That level of denial sounds like mental illness. Good writing. By the way. Love a plot twist. Once had an older lady call in wanting a prescription for pain meds because she was sure she had shingles. Said her neighbor had them and she was sure that's what it was. She hadn't been in for an exam in almost 2 years. So the doctor asked that she come in to be evaluated before a prescription could be given. She refused and called again the next day asking for a prescription. This went on all week. Her calling for pain meds, the doctor asking her to come in to be seen, She finally agreed to make an appointment. It wasn't shingles. It was a skin ulceration from advanced breast cancer. Why is it that older patients are always so stubborn? This has happened a few times. Actually. But I had a gal come in on Monday after being discharged from the hospital Friday after giving birth. So basically, we tell ladies to avoid intercourse until a doctor clears you. And well, her spouse kept insisting and insisting and insisting that Friday night she caved and let him go to town. He wound up tearing some stitches that were placed and bleeding like a stuck hog all weekend long. Came into our clinic. Blue in the lips and fingers. And her hemoglobin was for normal should be 12 to 15. She didn't wanna be a bother. So she waited until she started feeling dizzy all the time. She got another trip to the hospital for transfusion and repair for that. I said, this isn't the first time I've seen that. So for the love of homeboy is begging for it after you just had a baby. Maybe he needs a lesson in self-control and a bottle of moisturizer. Had a hysterectomy a couple of months ago. Doctor told me if I had sex I would pop the stitches and my bowel would fall out through my vagina. Needless to say, I wasn't in the mood after that. I've seen a few over the years. And they generally fall into the category of if it's not diagnosed then I can't have it. Or I didn't think it was that bad. As a medical student I remember an older lady that had a breast that was necrotic and falling off. It had been progressing over the last several years. But if she didn't get diagnosed with breast cancer, then she couldn't have it. In the other category I've seen a few cases of Fournier's gangrene. Pretty much obese. Male diabetics that had a pimple/sore that started in the pubic region. By the time they come to the hospital it's a raging infection where the treatment is basically to cut away everything in the pubic/groin region down to the muscle layer. That little sore didn't seem like much at first. I lost an elderly friend to that mindset many years ago. Despite 6 of her 7 siblings having died from some kind of reproductive/genital cancer, she never had a smear test. And ignored a pain that started in her womb region and spread out to her lower back. She'd just tell us she had sciatica. It wasn't until the cervical cancer was literally growing out of her that she admitted something was wrong. After the diagnosis, she just gave up completely. Refused to eat. It was over in a couple of weeks after that. She was an exceptionally stubborn woman. Not a doctor/hospital staff. But my grandpa ended up passing away because he waited too long before going to the hospital. This was about 17 years ago. He was tending to one his mules when something spooked it and he got kicked in the gut. He was in a lot of pain. Could barely move due to the abdominal pain, so decided to take it easy and lounge on the couch for a week. He refused to go to be taken to the hospital. Unfortunately, that mule kick ruptured an unknown tumor in his intestines. The doc said it was huge. Like volleyball size huge. And he may have survived if he came in sooner. By the time we got him to the hospital he had a severe case of gangrene. His leg needed to be amputated within a day of him being there. He passed away a week later. My grandfather was a stubborn old man too. I finally got to the point with him that I'd give him a choice between being driven to the hospital by me or taken there in an ambulance. But he was going whether he liked it or not. We once had a patient who went to emergency for abdominal pain and they discovered a fungating breast wound. Don't image search that she'd had for 2 years and hadn't gotten medical attention for. A biopsy and a PET scan later she was diagnosed with breast cancer with extensive liver, lung and bone mets. This was also in Australia, so it wasn't a money issue. Just sad. Image searched that. Highly regret it. Edit. r/I bleach. For those of you who need it. Well, now I'm curious. Edit. Unless you feel like skipping a meal or two. Don't image search this. No one is explaining what it is and I'm kinda scared to look it up, so could you explain it? It's like gangrene but with lichen looking bits. If you've ever looked up radiation ulcer, you'll be fine. I am a doctor and while working in A&E we had an older chap, possibly in his 70s, who several days prior to presentation had a sudden onset severe chest pain and vomiting while loading the car with shopping. He ignored it and struggled home. The next day he started to lose the use of both legs and by the time he came to hospital had been crawling around his house for several days because he thought it would get better. He had had a major cardiac event. Developed a clot which his heart had pumped out. It went down his body, broke in half and blocked off the blood supply to both legs. He literally had dead legs. I don't know what ended up happening to him, but there was no way to save the legs and I reckon the outcome was very poor, if not fatal. Edit because there is a lot of USA assumption going on. This is in the UK where healthcare is free at point of access. So debt is not a contributing concern for our patients. I was with my kid in emergency department allergic reaction and in the waiting room there was a family with a 2-year-old. Apparently that kid stopped walking and lost the use of her legs. 3 days before. They waited 3 days. Children's nurse here. My first week in pediatric ed we had a young girl 6/7 come in with a really swollen jaw/face. Poor girl was unable to move her jaw without intense pain and hadn't been able to eat for several days. Turns out she had only just started cleaning her teeth for the first time ever and managed to develop several abscesses and rotten teeth in the process. To make it worse, her mum told us she was recovering from the same procedures to remove most of her teeth because of almost the same thing. They didn't want to bother the GP as they thought she was just messing about to get out of school. All of a sudden I don't feel quite as terrible about the cavity my 6-year-old has to get filled. That poor little girl. This breaks my heart. There are people who develop cavities much easier than others. Even with proper mouth hygiene. It still happens. No need to worry about not being good enough. There is also a huge difference between a cavity and a rotten tooth. Rotten teeth have been left uncleaned and untreated for quite a while, so I think that's where parents actually should feel bad. Yep. I've always had good toothbrushing habits and still ended up with cavities almost every time I went to the dentist. Conversely, I take poor care of my teeth even though my grandfather was a dentist and never had a single cavity after 30 years. No gum disease either. Every dentist I've seen since my grandfather stopped practicing has said the same thing. Good genes. Edit. Fixed spelling error. Had a patient brought in by her son who took care of her. When she arrived to our unit, I performed a skin off her socks and found a fallen off gangrenous toe. Seems fake and I wish this was, but it was by far the nastiest thing I've witnessed. Son said he had no idea when his mother's foot became that bad. No words. Our X-ray prof told us this happened to her once too when she removed a person's sock to X-ray their foot. Hasn't happened to me yet though. When I read gangrene or diabetic foot or osteomyelitis in the medical history for any foot X-rays, and the patient has socks on, I don't take the sock off. Image is just fine with the sock on. The smell usually tips you off regarding how bad it is. Also, if it looks wet. I don't want to remove the socks and find out that chunks of skin is going to come off with the sock. Ew.